Surprising fact to hook the viewer. Did you know that nearly 30% of men suffer from some form of ejaculatory dysfunction, yet less than 3% seek help for it? The silence around this issue is deafening and dangerous. Before we dive into the shocking truths and powerful solutions behind premature ejaculation, take a moment to like, share, and subscribe for more life-changing health content. Drop a comment below if you've ever wondered how stress, hormones, or age could affect your sexual performance. Why this issue is bigger than you think. Let's face it, discussing sexual dysfunction is uncomfortable, but ignoring it comes at a huge cost. Premature ejaculation, PE, is one of the most common sexual disorders in men, and yet very few speak openly about it. Why? Embarrassment, stigma, and lack of awareness. PE isn't just a physical issue, it's deeply psychological and emotional, affecting confidence, relationships, and mental health. Whether it's a lifelong issue or something that developed later in life, understanding PE is the first step toward reclaiming your intimacy. Don't forget to hit that like button if this resonates and share your experience or questions in the comments. Your voice can help others break the silence. Breaking down the facts and causes. What exactly is premature ejaculation? There are two main types. 1. Lifelong PE, present since the individual's first sexual experiences. 2. Acquired PE, develops later in life, often after years of normal function. According to current guidelines, PE is defined by 3 criteria: reduced ejaculatory time, typically less than 2 minutes, loss of control, emotional distress, it must bother the individual. Interestingly, if a man ejaculates quickly but isn't distressed by it, it technically isn't classified as a disorder. Root causes, it's not all in your head. Biological sensitivity. Some men are born with hypersensitive penile nerves. This is why topical anesthetics like lidocaine sprays, e.g. Promescent, can help reduce sensitivity. Neurochemical imbalance. Low serotonin levels are linked to PE. This is why SSRIs, antidepressants like paroxetine or sertraline, can delay ejaculation, even when used on demand. Genetics. While research is still evolving, certain gene polymorphisms may predispose men to lifelong PE. Hormonal issues. For acquired PE, hormone imbalances like low testosterone or high prolactin should be tested. Psychological factors. Stress, anxiety, depression, collectively known as SAD syndrome, can play a massive role. A new relationship or performance anxiety can drastically impact ejaculatory control. Leave a comment if you've ever experienced these factors yourself or know someone who has. This is a community for learning and support. 0-0-0-530. Treatment. Real solutions that actually work. There are 3 main categories of treatment. 1. Topical therapies. Lidocaine, Shockrich, Prilocaine sprays numb the sensitive areas. Must be applied 10 to 15 minutes before intercourse and wiped off before contact to avoid affecting the partner. Be cautious. Overuse can cause temporary erectile dysfunction. 2. Medications. SSRIs like duloxetine, specifically approved for PE in some countries, can be taken daily or on demand. Tramadol, a narcotic painkiller, can extend ejaculatory time, but carries a high risk of addiction. This is not a first-line treatment and should be used with extreme caution. Alpha blockers like tamsulosin, Flomax, can help, but one side effect is retrograde ejaculation, where semen flows backward into the bladder. It's harmless but can affect fertility. Scientific evidence. A meta-analysis published in the Journal of Sexual Medicine found that SSRIs increased intravaginal ejaculatory latency time, ILT, from under 1 minute to over 6 minutes in some cases, a significant improvement. Lidocaine-based sprays were found effective in 70 to 80% of users in clinical trials. 3. Sex therapy, often overlooked but highly effective. Certified sex therapists can teach behavioral techniques like start-stop method, practicing control by stopping stimulation just before climax. Squeeze technique, applying pressure to the penis to reduce arousal. Most men prefer a pill, but therapy offers the closest thing to a long-term cure. If you've made it this far, show your support by liking this video and subscribing to stay updated on real, science-backed health advice. Conclusion: key takeaways and what you can do today. Premature ejaculation is not just a minor inconvenience, it's a serious condition that can disrupt emotional well-being and intimate relationships. But it is also highly treatable. Recap: prevalence affects nearly 1 in 3 men, yet few seek help. Causes range from biological and hormonal to psychological. Treatment options include sprays, SSRIs, sex therapy, and in some cases, medications like tramadol or alpha blockers. Retrograde ejaculation, a side effect of treatment that's harmless but can impair fertility. Before you go, don't forget to like, share, and subscribe. Your engagement helps us reach more people with vital health education. And leave a comment. What treatment do you think more people should know about? Remember, this isn't just about sex. It's about confidence, connection, and control.